Ebola exposure is a key question for everyone coming into Canada, and now there are new rules for people in the DRC, Uganda, and South Sudan.
Closing the borders for people coming from those three countries for 90 days, so tourists, but permanent resident and Canadian would be allowed to come back.
That two-track approach is an issue for some legal experts.
Travel bans in and of themselves have a mixed record of effectiveness. As it relates to Ebola, this current measure that the government has put in place really has the makings of a political, symbolistic decision as opposed to a public health decision.
The move from Ottawa is a key test post-pandemic of how people feel about more aggressive public health restrictions.
I think COVID weighs heavily on all of our minds. I believe that that is part of the thinking, which is that the Canadian public would be maybe less forgiving, even if a single case entered the country, if we didn't have enhanced screening.
Last week, the United States banned non-citizens and green card holders who had traveled to DRC, Uganda, and South Sudan from entering the United States. Officials in Mexico said they would be tightening up screening at airports and asking people to avoid traveling to those countries. This, despite the fact that the WHO has rated the global risk for Ebola as low, saying there was no need to restrict travel for non-neighboring countries. Doctors say it's a difficult balance.
The ability to contain it using the strategy, I think, truthfully, is unknown. I will say that the cautions against a strategy that was very restrictive is that there is a worry that people will then be more likely to lie about their travel history.
That level of uncertainty is both worrisome from the perspective of someone who's waiting, who puts a lot of money, a lot of time into the process of immigration, but also from the perspective of the message we're sending out to the world, especially at a time where we're going to be bringing so many folks to Canada.
Katherine Ward, Global News.